Hey, Laurel, can you hear me yet?
Hi there. Yep.
Hey, great. Yeah, that
Hi,
sounds
Brian.
great. Good audio.
Okay, good. Yeah, I'm just on my phone here, so
Perfect.
excellent.
All right. Do you want to, let's try sharing your screen real quick.
Okay, sure.
And you should be getting a pop-up.
Show my screen. All right.
Perfect.
Can you see it?
Yes, absolutely. Yep.
Okay. Great.
All right. So we'll be good to go.
Yeah, they do make it pretty easy.
They do. All right.
So yeah, you'll introduce the
Yeah,
presentation, and then I'll just talk, and then at the end you said people can type in questions or ask them out loud.
that's right. That's right.
Okay. Okay.
Perfect. So I'll probably take back control for a moment here.
Okay. How many people have signed up for it?
Let's see. I believe the count was 127 had registered.
Wow, that's great.
Yeah.
And do you get a final count of like how many people actually tune in
We do. We do.
live? Okay.
See, I see Ariana's with us from CDC.
Okay,
Good
great.
morning.
Hi,
Good
Ariana.
morning. How are you?
I'm great. How are you both?
Doing fine.
Doing well.
Doing fine.
Good. I'm going to keep my mic on mute because I left my normal headset at home, so I think the one I'm wearing picks up a lot of background noise.
Yeah, it does have some background noise. You're
Yeah.
right. Okay.
So I'm just going to mute myself so it doesn't cause any problems right now.
Okay. We just wanted to say hey.
Perfect.
Thanks.
Thanks for doing this today, for both of you.
We're very happy that you're free today. We're all looking
Yeah.
forward to this presentation.
Oh, thanks.
Hey, good morning, everyone. Welcome to the CDC Private Well Community of Practice webinar. We'll get started in about 1 more minute. I see quite a few people still joining us, so we'll get started in just a second. Okay, I think we can get started. Thank you, everyone, for joining us to the CDC Private Well Community of Practice webinar. I'm Brian Kirtland from Cloudburst, and we have Ariana Hanchi from the CDC. And just a reminder that after our webinar today, you can ask questions by either typing your question in or everybody is on mute. So if there is also a raise hand button on your webinar box, and you can press that, and I can take you off mute and call on you, and you can ask your question directly that way. So today, let me introduce our speaker. We have Dr. Laurel Shader, and she is a research scientist at Silent Spring Institute in Newton, Massachusetts, where she studies sources, fate, and transport processes and exposure to emerging drinking water contaminants. Her expertise is in environmental chemistry, environmental engineering, and public health. She earned her MS and PhD in environmental engineering at the University of California, Berkeley, and a bachelor's degree in environmental engineering science from MIT. The title of her talk today is Septic Systems as Sources of Pharmaceuticals, Fluorinated Chemicals, and Other Emerging Contaminants in Private Wells on Cape Cod, Massachusetts. And with that, Laurel, I'm going to turn the screen over to you.
Okay. Can you see it?
Perfect. Thank you.
Good morning, everyone. Thank you for tuning in. Thank you to Brian and to the CDC Private Wells Community of Practice for inviting me to have this opportunity to share results today. Today, I will be presenting the results of a study conducted by Silent Spring Institute looking at pharmaceuticals, fluorinated chemicals, and other emerging contaminants in private wells on Cape Cod, Massachusetts. I'm going to start by talking about what I mean by emerging contaminants and describe why they are of concern. I'd like to share some highlights of past Silent Spring Institute water quality research, and then go into some depth about the results of our private well study, which was published earlier this year in the journal Science of the Total Environment, and end by thinking about some of the implications of our work and next steps. So the topic of emerging contaminants, such as pharmaceuticals in drinking water, gained a lot of national attention in 2002 when the Associated Press released a study showing that the drinking water of at least 40 million Americans contained traces of pharmaceuticals. In addition, many studies have found feminization of male fish in wastewater impacted surface waters that is thought to be linked to hormones and endocrine disruptors. So these kinds of findings have raised many concerns and questions and have also been the topic of some humor as well. In recent weeks, you may have seen headlines mentioning perfluorinated chemicals, for instance, in Hoosick Falls in upstate New York, where PFOA, which was used at a plastics manufacturing facility, contaminated groundwater and ended up in both public and private wells. These same perfluorinated chemicals have also been found in the Flint River, which was the controversial source of drinking water in Flint, Michigan. So what are emerging contaminants and how do they get into the environment? So emerging contaminants, or contaminants of emerging concern, or just CECs for short, are a loosely defined group of chemicals that are not currently regulated in drinking water, but are of concern for ecological or human health reasons. Some examples include pharmaceuticals and personal care products, often abbreviated PPCPs, hormones, both natural hormones and synthetic hormones, flame retardants, and perfluorinated chemicals, PFCs or PFASs. So these are chemicals that are not currently regulated in drinking water. Some of them are candidates for future regulations. For instance, some of the perfluorinated chemicals have been on the most recent lists of unregulated contaminants that have been monitored by EPA in the UCMR3 program, as well as being on the contaminant candidate list. These are also chemicals that have been found in the environment, in surface water, groundwater, or drinking water. So when we say that they're emerging, in some cases these can be chemicals that are truly new into the environment. However, in many situations, these contaminants are considered emerging because our awareness of them and our ability to measure them at trace parts per trillion levels has really developed just in the last couple of decades. In addition, levels in the environment may be increasing through growing populations as well. The ecological health concerns have been better understood, particularly related to endocrine disruption, hormones and other hormone-mimicking chemicals that can affect fish reproduction. In terms of human health concerns, there really are a lot of questions and not really a lot of guidelines to help evaluate the effects of chronic exposure to low levels of these types of contaminants in drinking water. So how do emerging contaminants get into the environment? We often think of contaminants such as pharmaceuticals that can get into wastewater from a number of sources. So in our homes, when we actually take a medication, our bodies excrete some portion of that medication that can end up into the wastewater. In addition, people sometimes flush unwanted or expired medications. There can also be pharmaceuticals and pesticides that come from agricultural runoff or from livestock operations. In some cases, these contaminants can get into the environment from wastewater treatment plants or from septic systems. Neither of these waste disposal systems are specifically designed to address chemicals like pharmaceuticals. Some pharmaceuticals and emerging contaminants do break down in wastewater treatment plants and septic systems. Some can end up in the sludge, and others will be discharged into the environment through the effluent. Silent Spring Institute has been focusing specifically on Cape Cod, and the situation is a little bit different on the Cape because septic systems are really the dominant pathway by which wastewater is treated on the Cape. So Cape Cod drinking water supplies are vulnerable and may represent somewhat of a unique situation in terms of their vulnerability to emerging contaminants. 85% of homes on the Cape have septic systems. So rather than having a few centralized locations where wastewater is discharged into the environment, there are many small non-point sources located all throughout the Cape. The Cape soil are based on a sand and gravel sole source aquifer, so there aren't really confining layers to protect the groundwater aquifer from pollution at the surface. In recent decades, the population on the Cape has increased dramatically. And so all that means that the groundwater is vulnerable to contamination, and this is of particular concern on Cape Cod, where all residents rely on groundwater as a source of their drinking water. 80% rely on a public water supply, and 20% have a private well. So Silent Spring Institute is a nonprofit research organization. Our mission is to identify links between the environment and women's health. And we've had an active water quality research program based on Cape Cod for over 20 years. Our overall program objectives are to measure the levels of endocrine disruptors and other emerging contaminants in drinking water, groundwater, and ponds. We're curious how water quality on the Cape compares to other locations. We have evaluated how septic systems can be sources of emerging contaminants into groundwater, and we've characterized how they move through the subsurface. There have literally been thousands of studies done on treatment and discharge of emerging contaminants from wastewater treatment plants, but there's been much less focus on septic systems, despite the fact that 1/4 of Americans rely on them for their wastewater. We publish our results in peer-reviewed journal articles and really are dedicated to advancing our broader scientific understanding of emerging contaminants, but we also want to inform the local decision-making processes about wastewater management and drinking water protection. Right now, there's an emphasis on removing or reducing inputs of nitrogen into the environment. There are many coastal waters that are impaired by excessive levels of nutrients, and there are many communities that are considering various upgrades to their infrastructure, specifically to address the nutrient pollution. And we just want to be sure that those decision-making processes also take into account the other chemicals that are also present in wastewater. So now I'm going to just give some highlights of past Silent Spring Institute water quality research. Some of our earliest work, dating back to the late 1990s, focused on endocrine disrupting compounds in wastewater and groundwater. Our study in environmental science and technology was the first to identify certain estrogen mimics in household wastewater, groundwater, and private wells. In particular, we focused on a class of chemicals called alkophenols, which are used in certain detergents, and some are weak estrogen mimics. And our study showed that septic systems can be a source for alkophenols to enter groundwater systems. As I mentioned, there have been very few studies of emerging contaminants in septic systems. What we did in 2013 was to pull together the studies that have been published and to synthesize those results to get a better understanding of the typical concentrations of emerging contaminants that are discharged from septic systems and to evaluate removal efficiencies. We found that there is quite a range of removal of emerging contaminants. This was a study that looked at about 10 emerging contaminants, including pharmaceuticals and some personal care product ingredients. And we found in general that removal in septic system leach fields was similar to removal found in conventional activated sludge wastewater treatment plants. And this goes to show that to some degree, it's the properties of the chemical itself that can affect the biological and physical removal, both in on-site and in centralized wastewater treatment systems. We are currently in the process of updating this analysis to include more chemicals and more recent studies, and we'll be planning to publish that later this year. So we know that certain chemicals can be discharged from septic systems. What happens if they move through the groundwater? We published a study in 2006 where we tracked alkophenols, hormones, and other emerging contaminants up to 20 feet away from a septic system leach pit. And we saw that these chemicals can persist at that distance, particularly in parts of the plume where the dissolved oxygen levels were lower. And this is consistent with our understanding that under aerobic or oxygen-rich conditions, the microbial community is better able to break down these types of contaminants. We then broadened our scope to look at ponds on the Cape. So on Cape Cod, the kettle ponds are fed primarily by groundwater. These were formed by depressions in the glacial deposits that formed when Cape Cod was formed. And so as such, these ponds provide an integrated measure of the land use patterns in the upgradient area. We tested for pharmaceuticals and hormones in 6 ponds throughout the Cape and found that ponds that were more impacted by residential development, not surprisingly, had higher levels and more frequent detections of hormones and pharmaceuticals. Just to give you a visual sense of our results, on the left you'll see the results from our low residential density ponds, and on the right are samples from our higher residential density ponds, and you can see that we found more chemicals and the maximum concentrations were higher in ponds that were closer to more development, and that's consistent with our understanding of septic systems as a likely source. Of note, the highest levels that we found for some of these hormones were approaching levels that in some laboratory studies have been linked to ecological concerns. And then we turned our attention directly to drinking water. So 80% of residents on Cape Cod rely on public wells. And so we tested 20 wells in 9 water supply districts throughout Cape Cod. This was a study that was published in Science of the Total Environment in 2014. We tested each of these samples for 92 different emerging contaminants, covering pharmaceuticals, hormones, flame retardants, perfluorinated compounds, and a range of other emerging contaminants. We found that 18 of these chemicals were detected at least once, and that 3/4 of the wells that we tested had at least one of the analytes on our list at detectable levels. We found up to 12 emerging contaminants per well. And in general, we found that in wells that were in pristine areas, for instance, under a state park, where the nitrate levels were very low, we, not surprisingly, found very few or no emerging contaminants. And in the wells that are located in more developed areas where we see higher nitrate levels, these were the wells where we saw the highest levels and most frequent detection of emerging contaminants. This is just to give you a sense of the types of chemicals that we found and the concentrations. So what I'm showing here on the y-axis are maximum concentrations in nanograms per liter or parts per trillion. What I'm showing here are the chemicals grouped by certain categories. So for instance, these are antibiotics. This is showing that we detected 3 of the 30 antibiotics that we tested for. The highest concentration was around 100 nanograms per liter, and 60% of the wells that we tested contained at least 1 antibiotic. So we see that antibiotics and these 2 perfluorinated compounds, PFOS and PFOA, were detected most frequently in our public well study. We also saw other prescription drugs, organophosphate flame retardants, alkylphenols, and personal care product ingredients showing up in some of the wells that we tested as well. In general, the maximum concentrations were in the range of 10 to 100 nanograms per liter or parts per trillion. So that brings us to our discussion for today, which is on private wells. Our study objectives were to measure emerging contaminant concentrations in private wells across a gradient of likely septic system impact. So we aim to include some wells with very low levels of nitrate, where we did not expect to see many emerging contaminants. And then we also wanted to characterize what were the levels of emerging contaminants in wells with the highest levels of nitrate, and to look for a gradient in between. We wanted to compare our results to the public well study that we had previously conducted, and to look at other U.S. drinking water sources. And then we also wanted to evaluate whether markers of septic system impact are correlated with the presence of CECs. The types of analyses that we conducted are quite expensive. For the whole suite of chemicals we wanted to test for, the price per sample was about $1,800. So these types of analyses are not likely to be routinely done by private well owners, but we wanted to evaluate whether chemicals that are more frequently measured in private wells can give us a guide to help us indicate which wells might be most likely to have these other types of contaminants. So when we began our study, we put the word out broadly on Cape Cod, recruiting people to take part in our study. As I said, 20% of residents on the Cape have a private well, and in particular on this outer part of the Cape, these are towns that rely exclusively or almost exclusively on private wells. So we wanted to make sure that we had good representation in the communities that have the highest prevalence of private wells, but we also wanted to include wells from different parts of the Cape as well. We selected 20 wells out of our 110 volunteers to do the CEC testing. And we made our selection in 2 rounds. So the first thing that we did was for each of the 110 wells that were volunteered for our study, we used GIS to analyze the land use around each of those wells. We aimed to include some wells with a lot of residential development, with moderate, and with low residential development. Of those 110 wells, we selected 50 for a preliminary round of testing for nitrate and boron. These are both markers of wastewater, so we think that they would be good indicators of the extent of septic system impact. Of those 50, we received samples from 43 of those participants, and we analyzed the results and used that to guide our selection of the final 20 wells that we tested. Again, our goal was to include wells with a range of impacts, so low, medium, and high levels of nitrate, but we did put an emphasis on the moderately and highly impacted wells. We really wanted to get a sense of, in the wells where the nitrate levels are the highest, what are the types and levels of emerging contaminants that we might see. And we expect the results might be pretty heterogeneous because unlike public wells, which pull from a large area of land, these private wells have very small capture zones. So we expected a high degree of heterogeneity. So we tested each of these samples for 117 emerging contaminants. Compared to our public well study, we were able to include some additional chemicals, and we also had information at lower detection limits. The types of chemicals we included were pharmaceuticals and personal care products, hormones, PFASs, those perfluorinated compounds, organophosphate flame retardants, and some other chemicals as well, such as alkylphenols and herbicides. In addition, we evaluated other water quality parameters, including nitrate, total nitrogen, boron, total organic carbon, and sodium. We assessed nitrate and total nitrogen because we know that septic systems are the largest source of nitrogen into Cape Cod groundwater. However, we know nitrate also can come from other sources, such as fertilizers. So we wanted to have several other measures to tell us about septic system impact. Boron is widely used in certain detergents and soaps, and it's a very good conservative marker of septic system impact as well. Since we know that boron is also elevated in seawater, however, we included sodium just in case we had any wells that were vulnerable to saltwater intrusion. And then we also included total organic carbon because that can be another indicator of wastewater into the groundwater in Cape Cod. Our samples were analyzed by Eurofin's Eaton Analytical. At the time, they were known as Underwriters Laboratories, based in South Bend, Indiana. In addition to the individual samples from each well, we included some field blanks, a matrix spike, and duplicates. I won't go in depth into the methods, but just briefly, each sample underwent solid phase extraction, followed by liquid chromatography with tandem mass spec or gas chromatography with mass spec detection. And the detection limits for most of the analytes were below 10 nanograms per liter. I would like to mention that we tested raw, untreated water samples. So in some homes where there was no household water treatment, we were able to collect samples from faucets or bathtubs. Some homes, however, did have whole house water treatment, for instance, to adjust the pH or to filter out iron and manganese. And in those cases, we collected our samples prior to any treatment, just so we could get a good sense of what was really coming out of the ground and try to relate that to land use. So here's an overview of the characteristics of our final 20 wells. In terms of nitrate and total nitrogen, we see the mean and the median concentrations are all in the range of 2 milligrams per liter. And for nitrate, we included some wells that had non-detectable nitrate, and our highest level went up to 11, which is just over the drinking water standard. We also had a range of boron levels, again indicating that we've encompassed a range of wastewater impacts. TOC was only detectable in 5 of our 20 wells, so we weren't able to say too much about the distribution. Again, we analyzed sodium as a way to interpret any wells where we saw elevated boron to tell us whether there might be saltwater intrusion. And then we also asked homeowners about the depth of their wells. The range was 3 to 40 meters, or about 10 to 120 feet. And we were interested in whether well depth was associated with emerging contaminants. And we hypothesized that shallower wells might be more likely to have higher concentrations. So in general, just to get a sense of how we did with our goals in selecting wells, we found that 5 wells had minimal impact based on their nitrate concentrations. The background levels of nitrate on Cape Cod are around 0.2 milligrams per liter or lower, and anything below 0.5 is really considered background or minimal impact. So a quarter of our wells fell into that category. 5 wells had more moderate impact, between 0.5 and 2.5 milligrams per liter, and then half of our wells were in the more impacted category, having at least 2.5 milligrams per liter. Overall, of the 20 wells that we tested, 85% of the wells had at least one of the emerging contaminants on our list. And 27 of the 117 chemicals that we tested for were detected at least once. We did see quite a range in terms of the number of chemicals detected in each well. Some of the wells, particularly those with low levels of nitrate, had no emerging contaminants. And then we found up to 13 chemicals in an individual well, which was consistent with the nitrate levels that we measured in that well. So to give you a sense of the types of chemicals we found most frequently, we added some new chemicals this time around, and one of them was an artificial sweetener called acesulfame. This is a sweetener that's used in combination with other artificial sweeteners in many foods, such as low-calorie yogurts. And artificial sweeteners are very good wastewater markers because they are consumed at high levels and they end up in wastewater at relatively high levels, and they tend to be quite persistent in the environment. So 85% of the wells that we tested contained acesulfame. Basically, if we saw any other emerging contaminant, acesulfame was already there. And you can see that the highest concentration that we measured was 5,100 nanograms per liter, or about 5.1 micrograms per liter. So the concentrations were much higher than for the other emerging contaminants that we tested for. In our public well study, we only looked for PFOS and PFOA. These are 2 of the older legacy perfluorinated compounds. This time around, we tested for 14 different perfluorinated chemicals and found 5 of them. And about 70% of our wells contained detectable levels of at least one perfluorinated chemical. 2/3 of our wells contained detectable levels of pharmaceuticals. A quarter of our wells had detectable levels of organophosphate flame retardants, and 20% of our wells had detectable levels of hormones, although the levels were quite low for the hormones. This is a visual way to get a sense of the range of concentrations for each of the chemicals. So these here in orange are the perfluorinated chemicals. These little gray lines show you the detection limit, and on the y-axis we have concentrations, again in parts per trillion or nanograms per liter. So this shows you visually that many of the wells that we tested contained detectable levels of perfluorinated compounds. In the case of antibiotics and pharmaceuticals, you see that several of them were detected in quite a few of our wells, and then for other chemicals there were just sporadic detections. Similarly, for plasticizers like BPA and organophosphate flame retardants, those tended to show up in just 1 or 2 of our wells. Here are the detections of acesulfame, that artificial sweetener, which showed up in most of our wells, and then several other emerging contaminants, mostly personal care product ingredients. And here are those hormone levels that we detected, which you can see are quite a bit lower than for lower maximum concentration than for the other types of chemicals. This provides a little bit more information specifically about the individual chemicals that we found. So here's that artificial sweetener, acesulfame, found in 17 of our 20 wells, up to 5.3 micrograms per liter. We found 4 of these perfluorinated chemicals in at least half of the wells that we tested. PFOS and PFHXS are older legacy compounds. They're still present in the environment, but their production has been phased out in the U.S. because of concerns about their persistence, toxicity, and potential to bioaccumulate. PFBS is a replacement chemical, and it has a shorter half-life in people's bodies. It doesn't accumulate in people's bodies for as long, but we do see that it is quite persistent in the environment. Perfluorinated chemicals have a number of potential household sources. They're used in many nonstick and stain-resistant products, so think Gore-Tex, Stainmaster, Scotchgard, and Teflon. They also have many industrial applications and are used in certain firefighting foams, for instance, at airports and Air Force bases to fight hydrocarbon fires. Among the pharmaceuticals, the most frequently found chemical was sulfamethoxazole. This is an antibiotic used to treat urinary tract infections and pneumonia. It's among the most frequently detected emerging contaminants in other studies of emerging contaminants, and it was the most frequently found chemical in our public well study. So as I mentioned, it's really not feasible to test every single well for emerging contaminants. And so we were very interested in whether we could predict which wells had the most frequent detections and the highest levels of emerging contaminants. So what I'm presenting here are Spearman correlation coefficients. This basically is a measure of how closely correlated two factors are. And we're not necessarily interested in any one individual chemical, but really in the profile of the wells that are most likely to have emerging contaminants. So we have two metrics here. One is just the total number of emerging contaminants detected in each sample, and the second row shows the total concentration of pharmaceuticals that we detected. And we evaluated how closely correlated those metrics were with various chemical and physical characteristics of each of the wells. So in the first two columns, I'm showing the correlations with nitrate and boron. And we see that boron tends to be more tightly correlated with both of these metrics of CEC presence, although nitrate is significantly correlated with the number of detected CECs. And it's really useful to have both metrics if possible. For instance, there were wells where we saw high levels of nitrate but low levels of boron. And that was a sign that that nitrate was probably coming from another source rather than primarily from wastewater. We evaluated the residential density, so basically the average number of homes per acre in the zone around each of the wells. And we did see some correlation as well with that land use and with the number of detected CECs. Acesulfame was really the most strongly correlated with the presence of other CECs. And so while acesulfame is not something that's routinely tested for in wells, if there are opportunities to select one or a short list of emerging contaminants, this type of artificial sweetener is a very good marker for the presence of other types of emerging contaminants. Finally, we looked for correlations with well depth, and we did see significant correlations. And as we would expect, those correlations had a negative coefficient. So what that means is that deeper wells tended to have fewer CECs and lower total concentration of pharmaceuticals. This was really the first study to show that perfluorinated chemicals could be found in private wells that were impacted by septic systems. Typically, we think about firefighting foams or sort of larger industrial sources as the main source of perfluorinated chemicals into the environment. What I'm showing here are the sum of 5 fluorinated chemicals listed down here in nanograms per liter, and this shows the correlation with nitrate in each of the wells. And we see that for most of the wells, there's somewhat of a relationship here. And given the typical levels of fluorinated chemicals in wastewater, it's plausible that this represents septic system discharges as the main source of fluorinated chemicals. However, we did see a couple of exceptions where the levels of perfluorinated chemicals were much higher than we would have expected just based on the nitrate alone. And it's suggestive that other sources such as landfills or possibly commercial wastewater are additional sources. Again, these are all private wells. They're all mainly in residential areas, but there are some of these other types of sources that are potential contributors to the fluorinated chemicals that we measured. We also wanted to evaluate how our results on Cape Cod stacked up to other studies throughout the U.S. So what I'm showing here are the results for sulfamethoxazole, which was the most frequently detected chemical in our public well study and the most frequently detected pharmaceutical in our private well study. So I'm showing here the concentrations in the wells where sulfamethoxazole was detected. Here's our detection limit of 0.1 nanograms per liter. And we just want to get a sense of whether the levels on the Cape are as high as has been found in other locations. So what I'm showing here are the results of 5 other studies. This first one by Zimmerman included some public and private wells on Cape Cod, so kind of similar results. This was a study of 25 private wells in Nebraska. To my knowledge, this is the only other study that's really looked at emerging contaminants in private wells. And their maximum concentration was a bit higher than ours. And we only have the maximum value for that study. And then these last 3 columns are showing studies mostly of large public water supplies throughout the U.S., a mixture of surface water and groundwater sources. And what we're seeing is that our highest level here of sulfamethoxazole, both in our public and private well study, are really, in most cases, as high or higher than have been found in other locations. And particularly for the private well studies, this might be kind of surprising, given that these are just wells located in a residential area. We only did a very small sampling, and these larger studies really tried to bring in some of the most contaminated water supplies throughout the U.S. We also found similar patterns for some of the other pharmaceuticals that we detected as well. Okay, so how do we bring this all together? How do we weigh the effects of low-dose exposures to these parts per trillion levels of contaminants? So it's important to kind of put these results into a context. Like, what is a part per trillion? Are these levels that we should really worry about? So in the case of pharmaceuticals, it's really important to keep in mind that the amount of medication that you would ingest when you're actually taking a medication is much higher, orders of magnitude higher, than the amount of pharmaceuticals that you would ingest through drinking water. In the case of things like flame retardants or perfluorinated chemicals, it's likely that if you have a stain-resistant carpet or a couch with foam that's been treated with organophosphate flame retardants, that your exposure through use of these products, just having them in your home, may be much higher. And we're also kind of entering a new frontier in terms of the range of concentrations that we're looking at. Current drinking water regulations are in the micrograms per liter or parts per billion range, and now we're zooming in lower and looking at nanograms per liter or parts per trillion. Nevertheless, the presence of organic wastewater compounds in drinking water do raise concerns. So, for instance, in the case of pharmaceuticals, we really generally prescribe these for specific people for specific conditions. We don't tend to give them to children or to pregnant women. We know that they can have side effects at levels below the therapeutic dose, and we know that some people are more sensitive than others, for instance, in the case of antibiotics. Current regulations do not consider low-dose endocrine disruption, and we're really learning more that in some cases, low levels of exposure can cause effects that we might miss if we're only evaluating higher levels of exposure. And none of these regulations really take into account the potential synergistic effects of having a little bit of antibiotic and a little bit of many other chemicals all at the same time. I thought I would just share some of the report back materials that we used for our well owners. We put a lot of emphasis and a lot of thought into how we communicate results with our study participants. So these were developed several years ago. We now have a digital exposure report back interface. So anyone who does report back to private well owners can contact me if you're interested to learn more about our more recent report back models. For nitrate and for other regulated contaminants, we color-coded our results and provided some text to provide context, not just are you over the drinking water standard or not, but some more information about how to interpret those results. For unregulated contaminants, like the antibiotics, where there are no drinking water standards, what we did do was to plot an individual's results compared to the other people in our studies, and we provided some information about potential health effects And if people were concerned and wanted to filter their water, we provided some information about that as well. In terms of advice that we provided to study participants, we let them know that if their levels of nitrate were elevated or if they had emerging contaminants, that things like solid carbon block filters can be effective for removing certain organic contaminants. We wanted to convey the message of preventing chemicals from getting into wastewater in the first place and being good stewards of our water resources, for instance, not flushing unused medication or hazardous materials, and trying to reduce our household reliance on products that contain harmful chemicals. We recommend people maintain their septic systems. A well-functioning leach field will do a better job at removing emerging contaminants than a failing system. And we encouraged our participants to support local efforts to protect groundwater. For instance, minimizing wastewater discharges near wells by keeping open space. In some towns that are considering putting in town water for the first time, our study results can help bolster the case for health benefits from selecting water sources that have lower levels of nitrate and lower wastewater impact. So in conclusion, our key findings were that we found 27 emerging contaminants in 20 private wells that we tested in a sand and gravel aquifer in Cape Cod. The most frequently found chemicals were an artificial sweetener, fluorinated chemicals, and pharmaceuticals. Ours was the first study to show that septic systems could be sources of fluorinated chemicals to private wells. We found that 70% of our wells contained fluorinated chemicals such as PFOS that are found in many nonstick, waterproof, and stain-resistant household products. And we found both the older legacy compounds like PFOS as well as the newer substitute compounds. And we also found that nitrate and other markers of septic system impact were correlated with the presence of emerging contaminants, and that nitrate in particular, just because it's so frequently measured, may be useful more broadly as an indicator of emerging contaminants. Some of the next steps for our water research program, we would like to extend our results to testing private wells in other areas. We're curious how the levels of emerging contaminants might be different in bedrock wells that tend to be deeper but may have less active removal, given that that water isn't necessarily passing through sand. We are characterizing sources of fluorinated chemicals to better understand how these types of chemicals get from all the products in our homes into wastewater in the first place. We're interested to assess nitrate as a marker of emerging contaminants more broadly. On the Cape, nitrate may primarily come from wastewater. In other systems, nitrate may also be a better marker for pesticides or other agricultural-related emerging contaminants. And finally, we're interested in evaluating alternative wastewater technologies, for instance, how installing household eco-toilets like composting or urine diverting toilets can effectively divert some of these emerging contaminants such as pharmaceuticals and hormones. So with that, I'd like to thank the many people who helped with the development and implementation of the study participants, the funders of the project, and all the people who helped out with the analysis. If you'd like to learn more about our water quality research, you can visit silentspring.org/water. We've got all of our original research papers posted, as well as fact sheets and press releases. So with that, I'd like to conclude, and I welcome any questions.
Great. Thank you, Dr. Shader. That was a wonderful presentation. I appreciate it. Just to remind everyone that you can type in your questions, or you can use your webinar box and virtually raise your hand with that little hand button, and I can take you off mute and call on you. Let's see, Patty, can you ask your question?
Yes, hi, this is Patty Toccolino. I'm with the U.S. Geological Survey, and I was curious about your quality control samples. So you had collected field blanks and a variety of other QC samples. And I was wondering if you had any detections of some of these really low-level compounds, the hormones and pharmaceuticals, in those samples.
Yeah, thanks, Patty, for that question. In general, our field blanks did come out pretty clean. There were several pharmaceuticals including antibiotics, that did show up in just a couple of our field blanks and the lab blanks. These didn't really affect our analytical results from our samples because they were not chemicals that were found in our field samples. The one chemical where we did have some QA/QC issues was with PFOA. This is a chemical that's used in the manufacturing of old formulations of Teflon, and we did actually find around 3 to 4 nanograms per liter of PFOA in our private wells, in our field blanks and in the lab blanks. So that suggested that there was kind of background contamination in the laboratory. So we weren't really able to include PFOA in our other analyses. I would say that it does bracket the maximum concentrations that we might have seen of PFOA. I think our field samples went up to about 7 nanograms per liter. So we probably had a few wells where we saw like 2 to 3 nanograms per liter of PFOA, but it was really difficult to quantify that or assess the frequency of detection.
Right. Okay, well, thank you.
Thank you.
Great, okay. A couple of questions that were typed in. Are you aware of any similar studies that focus on pharmaceuticals and emerging chemicals in bedrock wells? I believe that's one of your next steps as well.
For private wells, I'm not. The only other study that I'm aware of is that well, that's a sample in Nebraska, and that was also in a sand and gravel aquifer. I think that that's an important next step.
Okay. Let's see. What were the private well depths, and can you describe the type of aquifer?
So the aquifer is a sand and gravel aquifer. There's really not much of any confining layers. In terms of the depth of the wells, I do have the range here. Let me just go back to that slide. I believe the depths are about 10 to 120 feet, 3 to 40 meters, and an average and median of 18 meters.
Okay. Is there any setback requirement for private wells from on-site systems?
My understanding is that on a property, the private well would need to be up gradient of a septic system by 100 feet, and there may be a setback distance from other properties, your neighbors' septic systems. So in most cases, we don't necessarily think that people's private wells are affected by their own septic systems, but they're more likely to be pulling water that's impacted by up-gradient septic systems.
Okay. Are you familiar with any well water test for chemotherapy drugs as emerging contaminants?
That is definitely a great question, and chemotherapy drugs make a lot of sense for future studies given their potency and their widespread use. I'm not aware of any commercial laboratories that currently test for them. I have seen several papers in the scientific literature where researchers have begun to measure chemotherapy drugs in wastewater treatment plants, and they seem to be showing up also at the nanogram per liter level in wastewater treatment plants. So, I think if we do additional studies, that would be a class of chemicals that I would like to try to include.
Great. Could you please talk more details about the GIS land use and and the selection of wells? What particular aspects did you look at?
So we used a methodology that had been developed on the Cape for defining protective zones. So we developed in GIS, it's basically like a 30-meter radius around each well, and then a 60-meter line in the up gradient direction. So it's a small zone. We had also considered using larger zones. I know the U.S. Geological Survey looks at like a 500-meter zone around each well. You know, it's difficult to determine exactly where a capture zone is for an individual well, and we know that the direction of groundwater flow varies depending on where you are on the Cape. In the middle of these groundwater lenses, the groundwater primarily moves vertically, so the capture zones are likely to be close by. At the edges of the lenses, the groundwater is moving primarily horizontally, so those capture zones are likely to be further away. So, you know, our goal was not necessarily to really characterize each and individual one of our wells, but just to get maybe some sense of the likely extent of residential development. We used the land use to characterize within that protective zone around each well. We looked at the percent of that zone that was had low density, medium density, high density, a range of density development. So we use that as one metric, just kind of the total amount of residential development. And then we also came up with an estimate for the number of homes per acre in that zone. And again, when we were using that to go from 110 participants to 50, our goal was to include some wells in very pristine, undeveloped areas, some moderate and some highly developed areas. We also wanted to get a sense of, or get a balance of different geographical distributions. And we had also asked homeowners to provide any past water quality tests if they had them. So we did, in some cases, have some preliminary nitrate data and some information about well depth to help inform that decision.
Great. Did you record the distances of wells from septic systems in this study?
We did not. Again, we didn't necessarily think that a person's own septic system was likely to be the source of contamination to their own well. And again, because we were really kind of uncertain about where the right location would be to look for a capture zone for each well, we didn't go too far along that route. I guess that's a possibility, but I think it's kind of challenging to figure out what's the right distance to look, because we think that it might not be necessarily your direct neighbor's well, but could be further up gradient.
Okay, great. Any more questions?
I would like to add that our paper I just want to add that our paper is publicly accessible. I think your email about the webinar had a link to the paper itself, and we paid for open access, so anyone can access that article and the supplementary information for free.
Okay, great. I can send that back out again. I'm getting a few requests for copies of your slides today. Would it be okay to share those?
That would be fine, yes.
Okay. Any other questions for Dr. Shader? Okay, well, if not, I just wanted to thank you again for your wonderful presentation. I want to thank everyone for joining us today. Let's see, our next webinar will be Wednesday, May 18th. And with that, I will look forward to seeing you soon. And thanks again.
Thank you, Brian. Thank you, everyone.
Thank you. Bye now.